Well, welcome back, everyone. Thanks for joining for another opportunity that we have to visit with a business leader around what they are doing to help their employees manage issues around mental health during this time of the pandemic. Today, I am talking to Erin Dugan. She is the CEO of KidsTLC, an organization in Olathe, Kansas. And she's going to take a few minutes to answer these three quick questions that we have and hopefully learn a little bit from another business leader and another organization about what they are doing to help employees manage this. We're all using Zoom and Skype a lot right now, and sometimes we're in meetings where they ask us to change our names. So Erin mentioned that her name is a little different than most you may see based on her most recent Zoom meeting. So Erin, thank you so much for taking a few minutes.
No, I'm happy to do it. Part of the taking care of our employees is staying playful. So my name on the screen was a playful interchange with some staff on a Zoom meeting this morning.
I love it. I love it. Okay, well, let's jump right in. So just tell me a little bit about your workforce and how the pandemic and the crisis has changed how your team is interacting and what their day-to-day looks like.
You bet. So we have about a little under 300 staff with KidsTLC. So we're a large group. And like everybody else, we've scrambled in the last couple of weeks to figure out how do we continue to provide services. We provide mental and behavioral health services to kids and their families, as well as autism services and lots of family support. And we committed very early on at the end of February that regardless of the circumstances, we were going to continue to offer that support to this community. That's what we do. That's been our mission, regardless of circumstances. So I'm super proud of the staff. But a couple of quick examples. We serve about 75 kiddos that live here on campus with us full time. So we run 24/7 residential care. So we are in fact essential workers. So we have a campus full of staff today. We're figuring out how to do homeschooling with 75 kiddos, and we've had a great day. A couple of our other programs, we have an outpatient therapy program where we have contracted therapists that serve hundreds and hundreds of kids and families in the community, and they've all are sitting similar to you in their basement or home office and doing telehealth services. They turned that around in 24 hours, went from an office program to an in-home telehealth, providing therapy to kids and families through telehealth. Our parent programs have all gone to a telehealth Zoom where families are Zooming in for tips and tricks and just some ways to stay healthy as a family and a parent during this crisis. We've got huge response to those parent groups that are happening. And then our autism program, our last program, our autism program was an in-clinic 8-hour-a-day program. And we have changed that. We're providing in-home services. So our autism therapists are in families' homes throughout the metropolitan area, using all of the precautions as an in-home essential health provider, and continuing those kids' very scientifically based intensive autism program. And we believe that's brought great relief to their families, that they can continue to make the gains they need during this challenging time.
Yeah, great. Well, it sounds like you are way ahead of the curve as far as adapting to this new environment. It sounds like you've done a lot of work and saw it coming very early on and began to make those adjustments. So kudos to you for that.
Thank you. We're proud of the staff and this team that got on it quickly, and it really has played out well for us in terms of continuing services.
That's great. And so moving on, tell me a little bit about what you're doing for your team and your employees. You mentioned you have about 300 associates. Do you have an employee assistance program in place? Have you leveraged that? Just what role has that played?
Sure. I'll reference two pieces that I think have been important to how this is going. This has been challenging for all our staff, so I'm not going to take away from any of that. We started about a year ago really with a wellness initiative about taking care of the people that are taking care of the kids. That we shared that early on. That was as important to us as the services we provide, that we were only as good as the adults and the workers on our campus and in this community. And so that foundation has helped us. We do have a strong EAP program. We've provided that information to our employees. They're using it as that fits their needs. We also are a campus full of counselors and therapists. So it's an ongoing, I say it's every day on campus is a big therapy group.
Right.
We know how to work and be empathic listeners and help folks kind of go through this time. We've been saying we're all grieving something in this process here.
Sure.
We're grieving normalcy. We're grieving time at school. We're grieving those of us that are on campus, that we're grieving the time that other folks are having with their families right now. So that's continued. We also have this campus model, and it's part of our Care for Kids model. In its PACE stands for playful, accepting, curious, and empathic.
Right.
And we've really reemphasized that approach. We're using that with the adults on campus, the families that we're in the homes with, that in times of challenge, we go back to our foundational skills. How do we stay playful in all of this? How do we accept how everyone else is feeling, regardless, without judgment or shame? We're asking lots of questions because this is new territory, right? So we're very curious. Like, how's this going for you? What have you done differently? How are your kids? Really staying personal with our staff. And the whole empathic piece, we've just got to listen and see what they need. I feel like I'm making it up every day, right?
Yeah.
Open door policies, folks are coming in. I'm surprised and shocked at what folks are dealing with personally. And yet they're still coming to campus and serving kids. It's been amazing.
Yep. And so you have a very unique approach to this, because you not only have your employees and your teams and all that, but then you have, if you will, your clients or the folks that you're serving and helping out. You're interested specifically about their mental health and about approaching them as well. The last question basically is around leadership and what is the leadership of the organization doing. But I'm talking to, the number one leader within the organization, obviously as part of a leadership team. But it's very interesting that you're focused on both those areas, not only your employees, but also those folks that you're serving and how you're going to serve them with regard to mental health as well.
Yeah. Running an agency that is so focused on mental and behavioral health, keeping the temperature of your staff all the time is so important, and having a sense of what they need and when they need it, and making sure resources are available. I think all of us in this particular industry have known that for a while. And luckily, we put some great things in place. We're doing as simple things as there's fresh fruit and cold water available whenever you need it. Some of the basic needs. We're trying to give you a break when you need it, so you can kind of do some mindfulness activities, giving them spaces for things just to be quiet. And we've had that in place for a while. Okay. And I think that foundation has kind of energized the staff that, we can do hard things because we've kind of been working on just the general mental health of our staff.
Yep.
So we approached this crisis with some stability. And yet, boy, we're navigating this every day, though. So I can't lie to you and tell you we've got this all figured out. But today's a great example. We are doing on-campus school in collaboration with the Olathe School District, and we set up classrooms in our residential, and our kids are like, wait a minute, we got to go to school now? And our staff are like, oh, thank gosh, we have to go to school now. And all the emotions that like the first day of school brought up this morning was hysterical. But, we're like their parents. So the 75 kids, we love them. Yeah. We need some structure back for everyone's sanity here a little bit. And so there's a great energy on campus. And I always say I have a large leadership team, and everyone matches our energy, and our positive energy is matched by our staff, and our staff's positive energy is matched by our kiddos. So that's kind of been our mantra, and it's going to get us through this. But we've had difficult days, and we have staff we're worried about and staff that have not feeling well, and we're tracking them every day and giving them lots of resources. Anyone not at work, we're calling and checking on them constantly, like family would. Yep.
Well, that's very wise that you look at it that way, as far as mirroring them and the approach that you all are taking. So thank you so much for taking a few minutes. I sure appreciate it. I know that what you shared will be very helpful to those watching. So best to you and your organization, and I certainly appreciate you taking the time.
Thank you, Ken. Absolutely.